hospice comes from medieval times when hospitality shelters provided rest for sick or weary travelers on long journeys. Cornerstone Hospice, a not-for-profit organization, has been providing care, compassion, and services to residents of 7 Central Florida counties dating back to 1984.
When folks think of Cornerstone Hospice, what they really need to know is that the scope of services we provide is designed to meet all of the needs of the patient who's facing the end of life. They don't really realize that when a patient comes under our care, in addition to the nursing visits that we provide and the CNA visits, we also have physicians who can make house calls, and then all of the medications, the equipment, and affiliated services like chaplains and volunteers, all that's included as part of the hospice benefit. We partner with medical professionals of all kinds, hospitals, skilled nursing, physicians, whether they're primary care or specialists. And what we want to make sure is that we focus on what the goals of the patient are. We want to make sure that individuals and healthcare professionals alike understand that we want to be a partner with them in helping meet those needs and wishes of our patients, whatever they may be. And we spend more time providing support and care to loved ones actually than we do for patients. Because while we may care for a patient for 3 weeks or 3 months or even 3 days, we're there for that family for that same amount of time. But we also reach out, and our bereavement team communicates with the family and makes phone calls, sends letters, because we want to make sure that those surviving family members and friends have the opportunity to give expression and voice to their grief and then move on to a revitalized, meaningful life again.
My husband was diagnosed with cirrhosis of the liver, and for 2 years we watched him go downhill. When he was getting to the place where we knew that the end was inevitable, my cancer returned. I was diagnosed with ovarian cancer, and it raised its ugly head again, so I was getting chemotherapy treatments and trying to take care of my husband when he was in end-stage liver disease. I can't begin to do justice to how important it was to have Cornerstone in our home. It provided relief for me in that I was able to get some needed rest, and it provided management of his physical symptoms, his medical symptoms. He was pain-free, and he did very well with hospice. You know, I would not have been able to take care of him the way that they did and give him the peace of mind that he received and the comfort, the absolute physical and spiritual comfort that he received.
Cornerstone Hospice tells us that hospice care is available to anyone approaching the end of life at any age, homebound or not, with any life-limiting illness. The cost of hospice care is generally covered by Medicare, Medicaid, and most private insurance companies.